I'd like for everyone to think for a moment about the value of human life. And does one person's life have any more value than another person's? The current fee-for-service healthcare system rations out care based on the patient's ability to pay. I believe this is unethical. It is criminal. 95% of the country is still functioning on this fee-for-service model. I believe everyone should be treated the same. Everyone should have access to primary care regardless of their ability to pay.
Hi, I'm Dr. Faisel Syed. Welcome to another episode of Faisel and Friends. We're here because we believe everyone deserves access to quality primary care, and ChenMed needs physicians to take care of them. Today's topic is the transition from volume to value. Dr. Dan, how are you doing this evening?
I'm doing great, Faisel. This is an exciting topic and an exciting guest.
I am so thrilled about tonight's topic. Dr. Dan will be co-host and will be moderating the chat, bringing in your questions and comments with our very special friend this evening. Our friend is Dr. Vivian Lee. Welcome,
Hey.
Dr. Lee.
Great to be with you guys.
Thank you so much for joining us. You know, your book, for the audience members who haven't read her book yet, her book really offers an optimistic action plan for reform. And it's for anyone. It's for employers, it's for payers, patients, clinicians, policymakers, anyone who wants to know how we can reform how healthcare is delivered in this country. This is the book you have to read. We'll be putting a link in the chat where you can go to Amazon to order yourself a copy, and we'll remind you again at the ending of the interview. So Dr. Lee, let's get started. My first question for you tonight is around medical debt. Medical debt is the number one cause of bankruptcy in the country today. And now 1 in 5 Americans they're in some stage of debt collection because of this, including myself. Actually, my wife, just in the last week, received a debt collection notice for a test she recently had. As a country, we're approaching $4 trillion in healthcare spending. Please respond to those in the audience or those listening who believe that we must reduce expenses by cutting care.
Well, it's so funny to hear that story because that actually happened to us too. And in fact, when I was the CEO of the health system at the University of Utah, we actually got into some trouble for one of my family members who, just had a little medical visit. So I know exactly what you mean by that. And for us, we're very fortunate because we're connected into the healthcare system. We can get these things sort of straightened out. But for most people, it's serious. It's actually really, this issue is not a lighthearted matter. It's not one that they can really laugh about in the way that we, hopefully your wife and you also can laugh about this soon. It's a very serious matter. And your question is really, I think, the core reason why I wrote The Long Fix, right? Because I think so many people here, we are spending so much money on healthcare in this country. It's about 17, almost 18% of the U.S. economy. It's almost 1/5 of the U.S. economy. So how could we sustain that? We've got to just cut care, right? The only way that we can kind of manage the financial piece of it is to cut care. But actually, you and I and Dr. Dan, we know that's really completely the wrong answer. And the fact that we are spending 2.5, 3 times as much on healthcare per person as any other high income or developed country is not because it's because we're actually spending that money in completely the wrong way. And in fact, 10% of Americans still don't have health insurance. They're still not covered. And COVID is just making that all the more terrible, really all the more terrible. So we just have to change our healthcare system to a way that actually I think ChenMed has really exemplified, where instead of just paying for more and more care, spending a lot of money that's wasted, a lot of money on administrative costs that are completely unnecessary. Instead, we need to really get bang for our buck. We need to really get value out of our dollars in healthcare. And if we do that, we should be able to spend less and have much better outcomes and much better health and much better public health, frankly, in this era of COVID, top of mind for all of us. So that's really what we need to focus on.
I agree. I mean, we agree. We're kindred spirits. Yeah, 10% of the country is uninsured, and of course, you mentioned how many people are functionally uninsured. They can't afford their copays or deductible.
Exactly. Especially now with the rising, high deductible health plans, that where we're sort of shifting that responsibility and burden on to employees. It's, you've got to pay out of pocket the first several $1,000s. It's really crushing people. And it's actually not really making them healthier, because it turns out that they're really just foregoing all care because they don't have the money to afford it, including the preventative care that's actually free for them since the Affordable Care Act. They should be able to get the free screenings and the free vaccines and so on. But they're even foregoing those with the high deductible health plan. So that's definitely not the solution either.
I mean, and then your book, you mentioned about life expectancy actually continuing to decline, despite the fact that we're spending all this money for this healthcare system. So the rest of the world is getting healthier and living longer. But meanwhile, American babies born in 2017 have a life expectancy of 78 years versus Japanese babies with a life expectancy of more than 84 years. So that puts us at number 26 out of 35 in the OECD nations. So why is that? And what are some things we can do to close the life expectancy gap?
That is such a serious statistic, and it was one that really surprised me, when I started looking back into this again for this book and for other purposes, to think that there might be 4 or 5 or 6 years difference in life expectancy for the babies today. That's just really unimaginable. The story really becomes even more clear when you look even more deeply into the data, which is that it's not that everyone lives that much less than the average baby born in Japan or in Israel or in, say, Switzerland. It's that it's so uneven in this country. And we know that there are areas where just one zip code or one county next to the other, there can be differences of even 10 to 15 years in life expectancy across those communities. And so I think one of the biggest issues for us is the really huge inequities really in health across the American population. If you're fortunate enough to have health insurance and to have access to health care, then actually your life expectancy is going to be pretty comparable to these other nations. But far too many people don't have that access. And that's really the biggest challenge for us, is we need to be able to make sure that everyone, I think you started this in your opening remarks for this show, everybody needs to get access to health care. And we know especially primary care and prevention. I mean, that's where we need to invest our dollars, not waiting too late for somebody to come into our emergency room with a heart attack and the stroke. That's too late. Those are all preventable, almost all preventable conditions even today. So that's what we need to invest in. I actually just heard this morning when you were doing your opening comments, it reminded me of something I heard this morning where someone said, you know what it's like right now, where you can, at least in a lot of parts of the country, you can go to one of the pharmacies and you can get your free vaccine shot, and you don't have to think about how am I going to pay for that. That's how all of healthcare should feel.